while healthcare providers in developing countries like Ghana often struggle with patient safety, quality demands, and have limited data and insight on overall quality. The situation where patients receive varied levels of care depending on where they live in the country is very unacceptable, they say. Now, this is because although access to primary health care has been promoted by players in the health sector, the issues about quality care have all been neglected. According to the World Health Organization, 1.4 million people suffer from hospital-acquired infection at every point in time. There are 300 plus hospitals in Ghana. 1 out of 10 hospitalized patients will acquire an infection. SafeCare empowers healthcare providers by helping them measure, monitor, and improve their services using innovative solutions. Well, in the studio with me is Bonifacia Benifoy J. She's with the SafeCare. She is the SafeCare Country Manager, Pharmacist Group, and Dr. James Dua is the Deputy Executive Director of the Christian Health Association of Ghana. Ladies and gentlemen, you're both welcome.
Thank you very much.
I mean, I haven't really heard before that people leave. Sometimes you do suspect, you feel like what at all is in this place and what can I take home after I have come to cure myself. But how bad is the situation where people are open to carrying home infections from the hospital? Any of you can go. I guess that this is more in line with your...
Right, so hospital-acquired infection is a problem that it's common not only in our part of the country, okay, but then the issue with ours is that it is all not monitored or it's not measured. So even though we can talk about the fact that there is a possibility of quality hospital-acquired infection, actual data on it is not available for you to even be able to tell the consume of it. But talking about quality, it's not only about the hospital-acquired infection. So what measures can be put in place for somebody to come to the hospital to receive the needed care that they are coming for, and also to be sure that the person is safe and will not, of course, acquire any other infection aside of it. That is what embodies all that we are talking about in quality.
Okay, I just want to find out quickly. You said that statistics are unavailable. Is it because we are not reporting, or we don't just realize it until it degenerates into something else?
So it's a combination combination of both. So it's about reporting, people data adequately being gathered and then propelled to the levels to be very well aggregated and analyzed. Okay. That is a major aspect of it. But also at the levels of primary healthcare, lower levels, also the ability to be able to detect or really detect that there has been a hospital-acquired infection is also another point. So usually in the secondary and tertiary, there are facilities in place or the expertise in place to measure those. But below that, it's also very difficult to get those data.
I see. Dr. G, I'm coming to you about what then we can do about such a situation. I mean, are there systems already in place that are not being, implemented, or they aren't at all? And what can we do?
Okay, thank you very much. So before we even talk about what we should do, let me put the situation you put forward in a better perspective.
Please.
So this year marked the first patient safety year.
What does that mean? First patient safety year?
So the first time the world over celebrated Patient Safety Day.
Okay.
This marked the first year.
And it became necessary because we realized that people are...
Yes. So every minute there are 5 people who died from hospitals, not because they went there ill, but because of quality issues.
Okay, and when you say quality issues, it's not just about what she was saying, picking up infections at the hospital, but about everything else that happens in the hospital.
Yes.
That puts you at risk.
Yes. So people are giving wrong medication. People pick up infections, which we call hospital-acquired infections, and 5 people are dying every minute. So in 1 hour, estimate the number. When we have airline which crashes and we are seeing that so many people have died, sometimes they ground the whole airline. But what happens if so many people are dying in our facilities? Why are we not grounding our facilities? So that is how bad it is, and that is why the Christian Health Association of Ghana has come out with this program, that we want to be sure that we institute systems that keep eye on what we are giving to the people.
I see.
Nobody should go to the hospital and pick up infection. Nobody should go to the hospital and have an intervention that will end in an adverse event.
And hearing you say this, I'll come again to what we need to do. Hearing you say this reminds me of a very tragic death of one of my colleagues who had gone for a cesarean section, and she ended up dying after that cesarean section. What has to be done? What ought to be done? I mean, there are people, doctor friends in the US who said that should never happen. They said the cesarean section is the safest, or it's about the safest surgery, and that should never happen. So what really can we do? I mean, and how can we even start? Where do we start from?
So there are various components in every health facility. And not only the intervention, it starts from leadership. It starts from human resources, there's management aspect, there are health information, there's research.
Okay, let's take it one after the other if we can briefly, and at least so our viewers can have an appreciation of the full picture.
Okay, so when you take leadership and governance for every health facility, this looks at, is the facility registered with the requisite regulatory authorities? So in Ghana, you have Health Facilities Regulatory Authority that ensures that every facility that is delivering healthcare has the license to do so.
Okay, so I can check that for where my friend died. I can check that. Yeah.
Okay.
No, I mean it's checked. So the next one. So is it registered? You say, is it licensed? It
yes.
Is. Okay.
And you want to make sure that the facility also has standards, protocols that it's using. And this leadership has to make sure that these are all in place. The other thing is human resource. Do we have the requisite number of staff to deliver the type of services that we need? So if you go to the primary level, you need maybe 2 doctors, you need this number of nurses, you need this number of enrolled nurses, midwives. Do we have that? Are we recruiting right? How do we check that the staff that we are recruiting are the right staff? Do they have licenses to do so, to provide the health services that we need? That is on human resource. Health information, how are we generating our data? How are we keeping the data? Who has access to the data? Where is it going? How do we utilize the data? So you have a facility that is providing health services. At the end of the month, you say, we have seen this number of patients. So and so came with hypertension, so and so came with malaria. How are we using that information?
Take some place like Kolibu Teaching Hospital. How do they manage a system like that?
So, if I may come in, when we're talking about quality, there are 2 major branches. You have the systems, and then you have the human face or human aspect. So when I talk about systems, we're talking about whether equipment are in place, there are processes and procedures that are defined, that are being used to do what has to be carried out, and are there monitoring systems that look at the outputs or the outcomes of what has been carried out. These are systems. So for instance, if we take your CS clients that you lost, the person, the friend, once the person go into the hospital, there is a process of admitting the person into. There are things that have to be carried out, as in examinations that have to be carried out. These are all defined. That's the standards that Dr. is talking about. So they are defined standards that has to be followed. And so if standards are not adequately followed, there can be a quality breach.
Is it possible that standards can still be followed and then there will still be a breach?
Right. It is possible because it's human being,
right.
And so human beings are using the standards, so a lot of things can come into play. But most times when standards are adhered to as they have to be, then you're able to also, even when there is a breach, you are able to quickly review backwards and be able to find out where or what is the source of the problem. What happens is that most times a lot of things are neglected, and so when there is even a problem, really going back to be able to evaluate and see where the source of the problem to nip it off is also a challenge.
Let's take the general situation in Ghana, so that both of you can help us understand. Will you be able to assess the general quality of care situation in Ghana as we wrap up the conversation? Yeah.
It's interesting. Let me put it this way. You have most of the times facilities, most of the time the public facilities who have the adequate or requisite skills in terms of the professionals that are in place. But most times in these areas for many reasons that are quoted, including pressure and so on, you get the behavior of the people not ending up the quality that we want. So they are qualified, they may even have adequate systems and also equipment and infrastructure, but then the attitude of people are a challenge.
Which then affects the outputs.
Exactly,
in the long run.
eventually. Then when you come back to
So will you be able to make an assessment of the general system in Ghana? I mean,
generally we say that quality is low.
Is low.
That's
low.
That's low.
Okay, Dr. Drea, is it low for you too?
Well,
from your perspective,
it is a little difficult to tell.
Okay.
And the thing is that we don't have a system that constantly monitors what is going on.
So monitoring,
yes,
is a big issue.
Yeah, so we need a system that constantly will prompt the, people will do what you inspect, not what you are expecting. And so that is the situation in Ghana now. We don't have any monitoring systems that constantly alerting institutions that this is your rating, this is where you are.
This HEFRA, is that not what HEFRA is supposed to be doing?
So what HEFRA does is that it assesses the facility before it starts operation.
And occasionally it goes out. Recently they've been going out checking, facilities and giving them licenses as well. So is that good enough?
It happens every 5 years.
Okay.
So HEFRA,
and within that 5 years, anything can happen.
Yeah, and HEFRA ensures that basic requirements to operate is in place. But we are talking about beyond that or above that, what systems are in place to do the monitoring. That's example of a tool is what we are going to use with Chad right now, the Safe Care Standards, which we are going to use. And it's
so wrap up with that for me, what the Safe Standards how it will help, and then we take your final words.
Yeah, so it's an internationally accredited standard that is set out to assess or rate facilities in all the operations that they are carrying out in the hospital, not only clinical quality, but also management and administration. Be able to rate what they are doing in there and be able to tell their level of quality that they have in it. And then also be able to benchmark the facilities among the group or among the set of facilities.
And will that information be available to people to help them make choices?
Yes.
Okay. Exactly. All right. So, Dr. Drea, let's take your final words as well as far as how your organization is going to be able to use this system to improve the quality of healthcare delivery.
Yes. Thank you very much. So now the ministry is focusing on attaining universal health coverage, ensuring that every Ghanaian everywhere has access to quality health services at the time that they need it. Now that cannot be attained without quality, and this is what we are focusing on. Trying to ensure that every Ghanaian, especially in the remote communities where child facilities are, when they go to the hospital, they are sure that what they are getting would end in positive health outcomes.
And this, I suppose, is only for child facilities?
Yes.
So for the government facilities, you can't be bothered?
Well,
we have to start from somewhere. So
okay.
Yes. We started from CHAG, and eventually it will be rolled out.
Okay. I really hope that you could form some alliances with HEFA as well, because then HEFA has a bigger mandate that, you know.
We work closely with HEFA.
All right. Well, thank you very much for helping us understand this. Well, next time when you go to the hospital, be sure to, you know, be careful before you pick up any infections back home. But also, you can speak up. You can ask questions if you think that some standards are not being followed. But it will be interesting to find out what those standards are so we can ask questions, because some of us, we do ask questions. Dr. James Dia is Deputy Executive Director of CHAG, that's the Christian Health Association of Ghana, and he's been doing this with Bonifacia Benefo Ejay, who is the Country Manager for Safe Care, which is with the Pharmacist Group. Thank you very much for coming. Well, we'll take a very quick break, but when we return from that break, I'll be taking you to the United States of America. Kojo Youngson will be joining us. We'll hear about what's happening with that impeachment process as far as President Donald Trump is concerned. Do stay.